mix. Good evening, everybody. Today we're gonna talk about first-line anti-TB drug. So many questions asked in a competitive examinations about TB. We deal here with mnemonics. So common mnemonics for first-line anti-TB drug. One is a PRIEST, PRIEST, and other is a Paris. So this is the two common mnemonics which we deal about the first line anti-TB drug, and it tells all the drugs lies in a first line anti-TB drug. So what is the meaning of P? So P for pyrazinamide. So pyrazinamide is a first-line anti-TB drug. It is used against the TB. What is the mode of action of pyrazinamide? So first we consider it disrupts the mycobacterium cell membrane metabolism. And other mechanism is it inhibits the mycolic acid formation. So this is the mode of action of pyrazinamide. So what is the consequences? What is the side effect? The pyrazinamide, the person having a pyrazinamide have a common side effect. It is a hepatotoxicity. So it has the highest hepatotoxicity among all first-line anti-TB drugs. Then it has also hyperuricemia. It means that it increases the uric acid, and that leads to the arthritis. So it's a common side effect of pyrazinamide. Second one, R represents for rifampicin. So R4, it inhibits RNA-dependent RNA polymerase. It's a mode of action. It inhibits DNA-dependent RNA polymerase. It means that RNA polymerase need for transcription process. Rifampicin inhibits the DNA-dependent RNA polymerase. It means that it inhibits the transcription process. It stops the transcription process. So what is the common side effects of the rifampicin? The person having rifampicin have a common side effect flu-like symptoms. Second one, urine discoloration. And it also deactivates the action of OCP. It means that the person having OCP should not be given rifampicin. And it is also cytochrome P450 inducer. So this is a common side effect, flu-like urine discoloration and OCP inactivator. Likewise, I represent for isoniazid. So isoniazid, it works by inhibiting the formation of mycolic acid synthesis. So mycolic acid is a prime component of the MTB. So it's a component of cell wall, it's a fat pad. So once the mycolic acid synthesis inhibit, MTB becomes deactivated, it means that it killed. And isoniazid, the common side effects of the isoniazid is first number one, hepatotoxicity. Second one, it causes vitamin B6 deficiency. Vitamin B6 deficiency. That leads to peripheral neuropathy. Besides the common side effects, it has also SLE, sideroblastic anemia, likewise the anemia in a person with glucose 6-phosphate dehydrogenase. Deficiency. So this is a common side effects of isoniazid. So likewise E stands for ethambutol. So E, what is the function of E? How it works? So the mode of action of ethambutol is it inhibits the arabinosyl transferase. This is the enzyme necessary for synthesis of arabinogalactan layer. This is also key components of the MTB. Once this enzyme is deactivated, arabinogalactan layers, which are essential components of MTB, cannot be sensitized. So MTB So what is the common side effect? So this is the key enzymes for the arabinogalactan layer. So it inhibits. What is the side effect? What is the common side effects of the ethambutol E4I? So it causes optic neuritis, or commonly we call red-green discoloration of eye. Red-green discoloration of eye. So PRIE, and last one, the drug which can deal in a first line of anti-TB drug is S for streptomycin. It's a class of aminoglycoside drug. It's a 30S binder, 30S ribosome binder. Once the bind, it inhibits the protein, stop the translation process. So what is the common side effect of the streptomycin? it cause auto toxicity. It means that ear problem and nephrotoxicity. So this is the we deal here priest, so PRIES, and last one T for TB. So this is a common drug which are used in a first line anti-TB drug. P for paracetamol, R for rifampicin, I for isoniazid, E for ethambutol, S for streptomycin. So likewise, you can remember the first line anti-TB drug in the terms of mnemonics varies. P for paracetamol, E for ethambutol, R for rifampicin, I for isoniazid, S for streptomycin. So hope you guys you better understand the mnemonics of first line anti-TB drug and their common side effect. Now we gonna deal about what is the MDR TB and what is the XDR TB. So what is the MDR and what is the XDR? XDR TB, MDR TB. So we commonly differentiate by the chart. MDR means multi-drug resistance TB. It means that the tuberculosis that are resistant to at least one of the first line TB drug, resistant to isoniazid and rifampicin. So what is the XDR? XDR means extensive drug resistance TB. So it means that it is a commonly we call MDR plus resistant to at least one of the fluoroquinolones drug like levofloxacin or moxifloxacin plus so resistant to second line injectable drug. So we call it the kanamycin or amikacin. So this is a condition of XDR TB. So it is difficult to treat. Then we use the second line of drug for the XDR and MDR TB. So now, second one, fixed dose combination. Fixed dose combination FDC in DARS. So what does it mean that direct absorb treatment short course. So we have a combination 2-FDC. It means that use of isoniazid plus rifampicin. 3-FDC. So isoniazid plus rifampicin plus pyrazinamide. 4-FDC. It means that isoniazid, rifampicin, pyrazinamide, and ethambutol. So commonly drugs are used for 6 months. So in case of pulmonary TB, so drugs are assigned for 6 months. So it has the 2 phases: intensive phase and continuous phase. Continuation phase. So intensive phase are assigned for 2 months. And further, this is assigned for 4 months. After that, it continued. So intensive phase, we use the 4-FDC, isoniazid, rifampicin, pyrazinamide plus ethambutol. So this drug up to 2 months. After that, 2 drugs are continued for up to 4 months. Isoniazid plus rifampicin. So this is a drug of choice and their combination. So what is the possible questions we deal commonly asked in a competitive examination? So we now discuss the MCQs about the first line anti-TB drug. Question number 1. Which one of the following is first line anti-TB drug? So we commonly known about that, we deal about that. Option number A, streptomycin. B, ciprofloxacin. C, clarithromycin. D, linezolid. So this is the options. So we know the mnemonics of first line anti-TB drug: PRIEST. So PRIES for streptomycin. So we deal here, streptomycin is a first line anti-TB drug. So we already deal about that. Streptomycin is a class of immunoglycoside drug. So it binds a 30S ribosome, and it is a protein inhibitor. It is caused nephrotoxicity and ototoxicity is a common side effect. Ciprofloxacin is a fluoroquinolones drug. So it is a DNA gyrase inhibitors. So what is the common side effects of ciprofloxacin? So it is a QT prolongation, tendonitis, and GI upset. So this is the common side effects of the ciprofloxacin, and it can be used as second line anti-TB drug. Clarithromycin is a macrolide groups of drug. So it is also protein inhibitors. It binds 50S ribosome and not used in a anti-TB drug. Linezolid is a 50S binder, 50S ribosome binder. So it is also protein inhibitor, and it is the second line of anti-TB drug. Anti-TB drug. So common side effect is a bone marrow suppression. So question number 2. So what is the question number 2? Common questions we ask about question number 2. Optic neuritis. It means that red-green discoloration of eye is common side effect of which anti-TB drug. So put the option here. Option number A, ethambutol. B, pyrazinamide. C, rifampicin. D, isoniazid. So we take the ethambutol here. Pyrazinamides have a common side effect, hyperuricemia. It means that arthritis and hepatotoxicity. Rifampicin has a common side effect, flu-like symptoms. Urine discoloration, OCP inactivator, so isoniazid has hepatotoxicity. Other one, vitamin B6 deficiency, peripheral neuropathy, likewise SLE, sideroblastic anemia. So E for eye, it means optic neuritis, red-green discoloration is caused by ethambutol. So now the question number 3. Which drug should not be given in patient with hepatic problem? Which drug cannot be given? Hepatic problem. The drug which have highest hepatotoxicity. So option number A, ethambutol. B, isoniazid. C, rifampicin. D, pyrazinamide. So among all, ethambutol has no hepatotoxicity. It's the safest in hepatic problem. So all three options B, C, D have hepatotoxicity. Among them, highest hepatotoxicity has the features of pyridinamide. So according to we choose the pyridinamide. Now the question number 4. Isoniazid works by inhibition of mycolic acid. Point number 2, inhibition of formation of arabinoglycan layer. C, inhibit translation. And D, disrupt cell wall formation. So among these options, mycolic acid is a primary site for the isoniazid. It inhibits the formation of mycolic acid, and inhibition of formation of arabinoglycan layer is a function of ethambutol, not a isoniazid, and translation like a streptomycin. So among these options, we can take option A, inhibition of mycolic acid. So question number 5. The standard duration therapy for pulmonary TB by first line anti-TB drug. So option number A, 6 months, B, 2 months, C, 4 months, D, 1 month. So standard duration time for pulmonary TB is 6 months. It can be divided into 2 phases, intensive phase So this duration is of 2 hours, 2 months. We use 4 drugs: isoniazid, rifampicin, ethambutol, and pyridinamide. So other the continuation phase. So continuous phase, further we assign for 4 months. Here we given 2 drugs of choice, isoniazid and rifampicin. So total duration we need 6 months. So question number 6. Which anti-TB drug is bacteriostatic in nature? So option number A, rifampicin, B, isoniazid, C, pyridinamide, and D, ethambutol. So among all drugs, among all the options, so option A, B, C has a bactericidal function except ethambutyl. So we can take ethambutyl. So question number 7. Which drug combination given in intensive phase of pulmonary TB while dealing with first line anti-TB drug. So we given here option. If option here, isoniazid, rifampicin, B, isoniazid, rifampicin, C, and parazinamide, C, isoniazid, rifampicin plus parazinamide and ethambutyl, D, isoniazid, rifampicin, pyrazinamide plus linezolid. So usually in intensive phase of pulmonary TB, we given the combination of 4 FDC, isoniazid, rifampicin, parazinamide, ethambutyl. But in case of tridot, we can only use this combination, isoniazid, rifampicin, and parazinamide. So now the last one, question number 8. Which anti-TB drug has ototoxicity and nephrotoxicity side effect? Option number A, streptomycin, B, isoniazid, C, ethambutyl, and D, pyrazinamide. So we already discussed about isoniazid, ethambutyl, parazinamide. So only the one options which we here given, streptomycin, is a class of aminoglycoside, has the effects of ototoxicity and nephrotoxicity. So we take the nephro. Thank you very much. So hope you guys you better understand the MCQs regarding the TB.
के तपाईहरु लाइसेन्स एक्जाम क्र्याक गर्नको लागि राम्रो स्टडी सेन्टरको खोजीमा हुनुहुन्छ भने आउनुहोस् तपाईहरु पनि जेनिक स्टडी सेन्टरमा। यहाँ दक्ष र अनुभवी शिक्षकहरुद्वारा लाइसेन्स, लोकसेवा र ब्रिज कोर्ससँग सम्बन्धित सम्पूर्ण कक्षाहरु सञ्चालन भइरहेको छ। हाम्रा विशेषताहरु डेली क्लास, डेली एक्जाम प्लस विकली टेस्ट। कन्ट्याक्ट नम्बर रहेको छ 984139